Okay, well, thank you everybody for sticking around this long. I really appreciate it. And I have to say that I've found a lot of the talks and a lot of the comments that I've heard so far today to be really fascinating. And I'm going to try to address some of the things that I've heard people say, see if I can say something about them in my talks too. This is a sort of a combination of my data and Stefan Lindeberg's data. As well as just some kind of thoughts as to what it might be or what of the many factors might be actually helping help show the paleo diet, is good for people with diabetes. I don't have the answers though, so bottom line. So we're going to talk a little bit about what are the goals of diet treatment in diabetes, and some of the paleo diet research results that we have and some of the comparison diets. And then again, a little bit about why might this be. So there's good data that suggests that if you have low fat, low carb, high fiber diet, exercise in people who have impaired glucose tolerance, and you also have weight loss, that you will help lower blood sugar levels and presumably lower insulin levels, especially if you believe the last speaker where low insulin levels is our goal. And so other things that have been shown to be helpful is for those people who tend to be round around the middle, optimizing waistline, not only decreasing what your blood sugars are, but how much sugar you take in and how much insulin, affecting other cardiovascular risk factors like high blood pressure and atherosclerosis. And then for diabetes especially, preventing the complications of diabetic disease, which are things like you can't see the nerves in your body are shot and your kidneys fail. So if you say, how well do therapies work, I like to use the Premier study because it was in sort of overweight, middle-aged women who had mild hypertension who were treated for 6 months. And the intervention group got a DASH-type, low-salt diet. They lost weight. They increased the amount of exercise. So if you had to say to yourself, what do we tell people to do? I mean, this is what we tell people to do. So then if you say to yourself, so how well did that work? Okay, in the Premier diet, yeah, their BMIs went down a little bit and their glucose improved a little bit. And their insulin levels went down a little tiny bit and their insulin sensitivity index improved compared to the control diet, where in the control diet, actually their insulin levels went up. So, yeah, if you say to yourself, what am I trying to do? So lower BMI, yeah. Lower insulin, yeah. Lower glucose, yeah. Does this treatment work? Yeah. But are the results very impressive? No, not even a little bit. And so then you wonder why it is that people don't seem to get very much out of diet, and we end up giving them pills all the time. It's because really diet isn't working all that great. So then you say to yourself, if you really want to give somebody a diet for their diabetes, what other options are there? And that's where we came to these studies with the paleo diet, where, like you can show, and actually, why don't I just show the results? So this was our study. Now, I work in a research center. So what that means is that we make all the food that we give to people. So they're not being told what to do. We have them come in, we figure out how many calories we need. We feed them exactly the diet we want them to eat. We make them bring back all the food that they didn't eat. We weigh them every day. We make sure that if they're losing weight, we feed them more calories. So in as much as you can control the things that you can control for diet research, we try to do that. So in our healthy volunteers, and these were healthy volunteers who were a little bit overweight, and in order to qualify for this study, they had to fail the exercise test. So we put them on a treadmill, and if they were at or below the average for their age and sex, then they were qualified for the study. And in these healthy people, otherwise healthy, after 2 weeks, okay, with no weight loss, because remember, we didn't let them lose weight, okay, what you can see is you guys see the, oh, here it is. No. Is there a laser pointer?
Yeah, it doesn't seem to.
No. Okay. So I'll just explain. So in the graph on the left, okay, what you can see is that the more the subjects followed the diet, which is the higher their urine potassium excretion was, okay, the greater the change in the amount of insulin. So the amount of insulin went down the more they followed the diet. And when you said to yourself, who are the people who got the most better? Like everybody got a little better, but the people who were insulin resistant were the ones who got the most better. And so that's actually what prompted us to do studies in people who had type 2 diabetes, is because the ones who were the most insulin resistant seemed to be the people who were doing the best. And this is Dr. Lindeberg's data. And in this study, they looked at people who had heart disease, so ischemic heart disease, which means their blood vessels are all clogged up with atherosclerotic plaques. And usually these people have high blood pressure, and oftentimes they're overweight. And when he put these people on the paleo diet, what he found, and this is the graph on the left, is that when they give people these glucose tests where you drink this glass of glucose and then you check to see what their blood sugar levels are, you could see that on the left, the ones who are on the paleo diet, their blood sugar levels didn't go up as high as the ones on the right, and the ones on the right are on a Mediterranean type diet. And when you looked at the total change in the amount of blood sugar over time when you have them drink this glass of sugar, then you could see that the Paleolithic group had much lower levels of glucose over time than the ones on the Mediterranean diet. And at the same time, and Dr. Lindeberg was looking at waist to hip circumference, so he's looking to see whether or not their waistline improved, and yes, they did. And then he did another study where he took people with type 2 diabetes and he switched them from one diet to another. And having tried to do a study like this, I am totally impressed that he got this many people to do this study for this period of time. This is amazingly difficult research to do. And what you can see is that the people on the Paleolithic diet, which are the round clear O's, okay, on the paleo diet, their hemoglobin A1Cs were lower, their HDL were higher. So HDL is the good cholesterol, was higher. Their triglycerides were lower. Their diastolic blood pressures went down. Their weights went down. So when they switched these people from one diet to another, they were able to find that, that these same people did better on the paleo diet than they did on this Mediterranean diet. And this is pretty amazing results because these people were not in a metabolic ward like the studies that I do. These people actually were just told what to do. Here's some instructions to follow. So the fact that they were able to show this at all with people who are out in the community who are just eating their food that they were making themselves over such a long period of time, really thought was very impressive. So we then went back, and again, we do studies where we make all the food for people and then we follow them every day. Okay, so this is from our study in our diabetic patients, and what you could see is that in the purple is the paleo diet, and in the brown is the American Diabetes Association diet. And our American Diabetes Association diet was really a Mediterranean diet. And so these measures of glucose control, like fructosamine and fasting blood sugar